So let's start with the first lesson in the name of God, where I start neurology, embryology, and at the beginning we need to know how in an embryo how the nervous system is developed. So before going to the CNS and PNS and nervous system, we need to know how the embryo is made. So the embryo is made from we know that secondary oocyte or ovum gets together with sperm, right? Ovum, however, we call it secondary oocyte, with sperm gets together and makes the zygote. So we know that ovum and sperm makes the zygote, and zygote is a cell, right? Zygote is a cell. It's made of two gametes. One is male gamete and female gamete. Once the zygote is made, then this zygote is a single cell, and it undergoes mitosis. We know that mitosis means that whenever a cell is divided into two duplicate cells, it means that it makes two cells like the copy of the first cell. So the zygote undergoes meiosis and mitosis, and in mitosis, the cell this one cell becomes two cell, and two cell becomes four cell, and four cell becomes eight cell, and eight cell becomes 16 cells. So this is the process of mitosis and zygote. So whenever the zygote reaches to 16 cell, which is called morula, right? 16 cell, it is called morula. These topics are all explained in a reproductive system. However, it is not here in neuro, but still it has got to start from there. Whenever a morula is made, morula means that a bag of cell or a ball of cells. Then after morula, blastula is made. What does blastula means? That all the cells gets to one side, and the rest of the cell becomes is like a cystic, it becomes like a cyst. Like all the cells get together here, and this side becomes like a cyst. This is called blastocyst. And so here, why I'm explaining about morula, blastula, and blastocyst, because we need to see that how this germ disk is made. This germ disk is made out of these cells. These cells started from sperm and ovum got together, and they made one cell, and this one cell underwent mitosis, and the cell was divided into pieces, and all the cells that were divided into pieces got together in one place, and the other place was like a cystic. That's why it's called blastocyst. Blasto means immature cells, which is this part, and cyst is this part. So this part makes germ disk, and germ disk is the primary embryo. Whenever germ disk is made of two layers at the beginning. One layer is called epiblast, and the other layer is called hypoblast. Epiblast is the upper layer, and hypoblast is the lower layer. It means that it is bilamellar germ disk. It has two layers. That's why it's called bilamellar germ disk, and it is made in week 2. So remembering bilamellar germ disk and second week, it's not difficult to remember because it has two layers and it is made in week 2. So, and we know that the layer that is to the outside, it is called EP, and the layer to the inside, it's called hypo. And then whenever the third week arrives, so the germ disk is divided into 3 layers. It means that this was 2 layers, and now it is 3 layers. The first layer, which was the upper layer, which was EP blast, it changes to ectoderm. Ectoderm is this one, right? I hope everyone can see what I'm writing. Let me zoom in the screen, because some people said that they cannot see the screen properly. So we said that we have 2 layers. One is epiblast and the other is hypoblast, right? It was in the second week of development, embryo development. And in the third week, another layer arises in between. Let's see this one. Like, this is now 3 layers. And how to remember this? We say that this is called gastrulation on 3 lamellar germ disk, and this one develops in the third week of development. So how does it develop? The epiblast changes to ectoderm. So EP is also outside, ecto is also outside. So we don't need to memorize it. EP changes to ectoderm. And hypo is inside, so hypo is down, right? The hypo changes to endoderm. So we don't need to forget this one as well. So, and the mesoderm is the middle layer. And this is, of course, if we know that ectoderm is the outer layer and endoderm is the inner layer. So, of course, in the middle, it is mesoderm. So now we know that whenever these three layers are made, ectoderm, mesoderm, and endoderm, now that we have ectoderm, we know that neural tube, neural tissues, everything as develops from ectoderm. That's why we needed to have ectoderm here. The neural tissues or nervous system did not develop in second week of development. Why? Because we didn't have ectoderm. That was epiblast. That was not ectoderm. Now that ectoderm is made, we know that now it's the time for the neural tissue to start developing. And so how does ectoderm mix neural tissue? However, we know that ectoderm means the outer surface or the outside of something. So we can imagine that everything in outer surface of our body is made of ectoderm, generates from ectoderm. For example, skin. Skin is also made of ectoderm. So how does it develop? We say that in this layer, which is called mesoderm, there is and the 19 days of development, day 19. Day 19, which is almost at the end of, in the middle of third week, notochord is developed. Notochord is a pattern in the middle of the mesoderm, and this notochord helps ectoderm to make a nervous system. How does it help? Can anyone talk to me and tell me how notochord is able to uh, make a nervous system out of ectoderm? Is there anybody to help me? I really like the classes to be interactive, so I cannot see the comments because I have shared the screen. So I'm sure that maybe some people have said the answer. So whenever notochord is made, notochord is very important for beginning of nervous system to develop. And in NDME questions, you usually see the days. They usually ask you which day notochord is made, right? Like directly or indirectly, they are asking the days. So how to remember notochord is made on day 19? So N for 19 and L for notochord. So you will not forget it. So in day 19, uh, not 90, okay? Because we know that these three layers are made in third week of development. So of course, in day 19, not 90, and day 19, notochord is made, and then once notochord is made, inside notochord, there is a very important gene which is called, what is it called? Can anyone unmute himself or herself to help me? There is a gene called means sonic hedgehog gene. This gene is very important for neural development. So whenever somebody asks that where this gene come from, we know that this gene is inside notochord, and notochord has this gene. And with this gene, notochord helps with the development of neural tissue out of ectoderm. It means that notochord pulls the the ectoderm inward. So this is notochord, and this uh, ectoderm is pulled inward, right? And you see that at first, like a plate is made, which is called neural plate, right? This is called neural plate because notochord in the middle in day 19 pulled the ectoderm inward and made the neural plate. And this sonic hedgehog gene inside notochord helps this neural plate to fold more and makes the fold more. So that now this is called neural fold. And once this is joined together, this both side gets together. Now it is called neural tube. It means that the notochord in the middle layer makes neural tube out of neural ectoderm. Let's see in the pictures because I'm not good in drawing. So here, now that we know the concept, we know that this is three layers. Let me make the pen smaller. So now that you see neural plate, you know that neural plate is a part of ectoderm. How is it made? It is made by notochord. Notochord with the sonic hedgehog gene pulls the neural ectoderm or the ectoderm inward and makes the neural plate. And once the neural plate is made, neural fold is developed. And at the later stage, this fold, this side of the fold, this the side of the fold and this side of the fold gets together and makes a neural tube. Now that we know that neural tube is made, we know that a neural tube develops into CNS. And we know that CNS is made of two parts. One is the brain, the hemispheres, and the other is spinal cord. Spinal cord. So now we know that how the CNS is made. We know that everything inside the brain and everything inside the spinal cord, it is called CNS. And whatever comes out of the spinal cord and out of the brain, that is called peripheral nervous system, right? So now we understood that central nervous system or CNS is made out of ectoderm, how it is made, notochord pulled the ectoderm inward and made a neural plate, and then neural plate was changed to neural fold, and then neural fold was changed to neural tube. Here we know we need to know two dates. Two dates are very important for NBMEs, and they are usually asking with these dates. And I remember I saw a question, even I can't say in the exam, but you guys may understand that these questions may appear in the exam as well. Like notochord is made in day 19, and neural tube is made in day 22. And how to remember? Because at the moment it's very easy for everyone to remember day 22 and day 19. But once you finish all first aid book, it's very hard to remember the numbers. So let's make mnemonics for the numbers. And it was so helpful for me. And you guys can also use it. So whenever we say 22, don't say 22, just say 20 tube, 20 tube. It means that tube is made in 22nd day, 22, 20 tube. And believe me that you will see a question, especially from here, because neural tube is very important. And of course, if it is opened or if it is not closed, we will see a lot of neural tube defect, and the exam will examine that which day it is made and which day it's completely made. So day 20 tube makes neural tube, and day 19, 9 for notochord and 9 for 19. So these are the mnemonics that was very helpful for me. Now let's read the text, see if we were right or not. Notochord induces overlying ectoderm. How does it induce it? With shh gene, right? Shh. Notochord is working, right? Whenever we say somebody to be silent, we say shh. Notochord is working. Notochord is making the CNS. So notochord induces overlying ectoderm to differentiate into neuroectoderm. Notochord becomes nucleus pulposus of the intervertebral disc in adults. So we understood everything about CNS. We understood that notochord makes the CNS, especially the neural tube. So what happens with the notochord itself? The notochord itself becomes the nucleus pulposus. So what is the nucleus pulposus? Whenever you're reading first aid, word by word, you should understand whatever you're reading. We don't have to read it just like finishing the lines. We should understand it as well. So nucleus pulposus intervertebral disc. And we know that the vertebrae and the body, if we see from the, these are the body of the vertebra, right? And in between two vertebrae, there is a disc, and this disc has the rule of like a cushion for the vertebrae to stay on each other, right? So this is like a disc, like this. If we take out and bring it here, we see that intervertebral disc is like a disc, and it has an outer port and it has a nucleus inside. So of course, notochord is like a round cell, right? It makes the nucleus. We will not forget that. At the moment, I know that everyone understands it, but once you finish the first aid book, it is hard to remember that which part of disc is made of notochord. It was hard for me. So notochord, 19 days, nucleus. Everything starts with N. Nucleus pulposus, notochord, and day 19. So notochord is made in day 19, and once it makes the neural tube tissue and a neural crest and everything, I will explain the rest. So what does it happen to itself? It changes to nucleus pulposus and intervertebral disc in adults. So this is the notochord, which is changed to nucleus pulposus. And what is this around the disc? This is also important. This is called annulus fibrosus. Annulus means that around, right? It's like a circle. This is also not difficult to remember. So nucleus stays inside and annulus stays outside. So annulus fibrosus, we say, whenever we say the name, we know that this is a circle in the outside of the disc, and it is made of fibrotic tissue. So it is a little bit harder. It is a little bit stiff. So according to the names, we can remember what the function is and where it exists. So whenever we say nucleus pulposus, nucleus stays inside and it is made of notochord. And whenever we say annulus fibrosus, intervertebral disc, we know that annulus is a circle around the intervertebral disc, and it's made of fibrosis, and it is a stiff. Whenever one vertebra pushes to the other vertebra, so that disc herniates, right? And the hernia happens with the nucleus pulposus, because this nucleus pulposus is not a stiff, and this annulus fibrosus stiff. This comes out whenever we say disc hernia. We mean that nucleus pulposus trying to come out of the annulus fibrosus, because fibrosus is stiff and annulus and nucleus pulposus not. So this was an integration with musculoskeletal system. Uh, so whenever you're studying, you have to integrate and you have to bring topics from all the systems. You have to be able to connect each system with each other. You don't have to be only focusing on neuro, because the purpose of this exam is that are you able to integrate many systems and many subjects together. And so now that we understood that notochord makes nucleus pulposus, now we switch to neural plate. We know that neural plate is the inward the inward part of the ectoderm, which was pulped by the notochord, gives rise to neural tube and neural crystal. So how neural crystal is made? Whenever we understood that neural tube is made in day 20 tube, 22, right? It is made. So what is neural crest? Of course, when neural tube makes CNS, then the particles around, this is neural crest, is the particle around the neural tube. So the particle and the periphery should make the peripheral nervous system. It makes sense to say that the tube in the center makes CNS, and the particles that are cresting around the neural tube, they should make neural crest, and they should make the peripheral nervous system. It's not difficult to remember. So neural tube makes the central nervous system, and neural crest, which is the particles around the CNS, it makes the peripheral nervous system. Does that make sense to everyone? I'm sorry that I'm teaching as a beginner level, and those who have already done neuro, it might be so like simple or easy, but this is the way I usually teach, and I really, and even when I'm studying with myself, I usually try to explain the way that it should make sense to me, right? So what now that we understood that this is, let's see. This is the neural tube. It was made in the middle, and this is making the CNS, and these particles which are resting around the neural tube, and it is the particles that once the neural tube was made, that these particles of neural tissue around the neural tube makes is called neural crest, and this neural crest makes the peripheral nervous system. These neural crest, these particles migrates, like it doesn't stay here. The CNS stays here, but these particles goes around. Where does it go? It goes to the heart. Cardiovascular system. What does it make in heart? It makes endocardial cushion. It goes to the skin. It makes melanocyte, right? Melanocyte. And it goes to the medulla, the adrenal medulla, and it makes the epinephrine and norepinephrine. It goes to the GI system, and it makes enteric nervous system. And this neural crest cell makes the cranial nerve, everything which we see in peripheral nervous category, that then it's made of neural crest cell. So just bear with me. We will come to the peripheral nervous system, and we'll see what happens if neural crest cannot migrate, right? So let's see. Let's look at the CNS first. Now that we see that this tube is made, right? You know that this is making CNS in the upper body. It makes the brain, and in the lower, it makes the spinal cord. So now we see the inner layer of this tube. If you look at the inner, you know that inside this tube, it is an empty space. It is a cystic space. So in the upper brain, it should be what? What should it make? It should make the ventricles, right? Because the ventricles is the cystic space that it has CSF inside. And whenever whenever you see this empty or cystic space downward or in the lower part of the body, it is making the central canal. So the empty part will make lateral ventricles or ventricles in the brain, and in the lower or spinal cord, it makes the central canal, right? And when you also see this, you see that navy blue, dark blue circle around. So now you know that if this is ventricle in the upper brain and if it is central canal in the spinal cord, so around the spinal as central canal around the ventricles, which cells are there? Anyone remembers which cells stays around the central canal and the lateral ventricles or any ventricles? We know that epididym cell, right? I'm sorry for the some words that because we are studying so fast, some of the cells just we make it short. The way that we write prescription, we also during studying U-word and studying first aid, everyone talks so fast. That's why I hope I'm not talking so fast and it is comfortable for you to understand me. So these are the cells around the ventricles, and it is called the epithelial cells, right? And we understood everything about this. And now that central canal is made, we look at the walls. We divide the tube into two parts. One is, if we look at the above, one is the anterior part, the lateral walls. One of them makes the anterior wall and the other makes the posterior wall. Even if you look at the brain, even if you look at the spinal cord, the walls are divided into two parts. One is the anterior part and the other is posterior wall. Anterior wall is called a ventral part and the posterior is called dorsal. Ventral and dorsal. Dorsal is in the back, ventral is in the front. And this sonic hedgehog gene, which is from notochord, you see that it is in the anterior. Notochord is in the near to the anterior wall of the spinal cord or brain. So whenever we say brain, brain is also divided into two parts. This is anterior part of the brain, and this is the posterior part of the brain. And the same way, whenever you make a spinal cord cross section, this is the dorsal horn, and this is the ventral horn, and these are the lateral parts, right? So that the tube, this neural tube, which is made at the beginning, it is divided into two walls. One wall, the lateral wall, becomes the anterior wall, and the other one becomes the posterior wall. So how is it helped? So is it the notochord that is still helping both of the walls? No, the notochord only helps with the anterior wall, which is called ventral wall, or the ventral part, which is having the function of motor, either in brain or spinal cord. The motor function is in the ventral part or in the ventral horn in the spinal cord. And whenever we say that dorsal or the posterior wall of the posterior wall of the neural tube, we know that there should be something to help, and there should be a protein or gene to help with the posterior wall as well. So let's see. For the anterior wall, we said that this notochord is close to the anterior wall. So notochord has a gene called sonic hedgehog gene. And for the posterior wall, you see that ectoderm is close to that. So ectoderm here in the periphery has a protein called BMP. BMP protein helps with the posterior wall. So posterior wall makes the sensory part of the brain and spinal cord, and anterior part makes the motor part of the brain and spinal cord. So and we also call it efferent for motor and afferent for sensory, right? We are going to talk about afferent and efferent later on. Just it was an idea just to remember that according to the photo, that which gene is helping which part of the brain, because you will see a question about these BMP and sonic hedgehog gene. So let's see what does the first text say about that. Alar plate or dorsal part. we said that the lateral walls of neural tube divided to alar plate and basal plate. Alar plate is called dorsal wall, which is the sensory part of the brain and spinal cord. And this is induced by bone morphogenic protein. Bone morphogenic protein is a protein, and this is coming from the neuroectoderm in the back, right? In the back. And basal plate, which makes the ventral part or the anterior part of the spinal cord and the brain. This has the function of it carries the motor function, and it's induced by the sonic H-Hawk gene. Why it is induced by the sonic H-Hawk gene? Because in the anterior part, the notochord is close to the anterior part of the brain and the spinal cord and embryo. That's why for the anterior development or ventral development or basal plate development, we have sonic H-Hawk gene from notochord, and for the posterior or dorsal, we have BAMP. How to remember this? Because we understood the concept, and for remembering, for memorization, we need to make some mnemonics in order to not to waste time remembering all the mechanisms. So for the basal plate or ventral horn or of the spinal cord and ventral part of the brain, we need the sonic H-Hawk gene. We say that shh, motor is it's moving, shh, moving. And for the dorsal or alar plate, we can say that bump. Usually the core bumps in the back of something, right? So we don't forget these two genes, which are very high and important. Okay, so let me see in the chat box if somebody is okay. Yeah, nobody is asking anything. So, do you like the pace and the speed? And am I too slow? Am I too fast? Please give me feedback, because I need the class to be interactive and live. And if anybody wants to unmute himself or herself and continue with me and interact with me, it will be great. So, do you have any comment till now? Is it good to continue like this, or should I go faster or slower? Just let me know.
Please, I think you're doing well so far. It's good.
No, thank you so much. Thanks for the feedback, doctor. So let's go ahead. Now let's see how this becomes more interesting and more interesting. Believe me and trust me that First Aid is a really friendly book. You will be in love with First Aid once you read it by heart, and you understand it well. Especially the neurology is not difficult. I see people go around and skip First Aid and do PDFs from different resources, which I respect. It's okay to do that, but first, please study First Aid. Please read First Aid properly and engage with First Aid. Do it properly. For repetition, for review, it's okay to go for the other resources, but First Aid is really a holy book. I really respect this First Aid and really love. I'm in love with doing First Aid. That's why I'm teaching it. However, it is not the place for me to teach, because I have a lot of rotations. I have 2 incoming rotations in the hospitals near my location. But still, I cannot separate myself from First Aid, and I don't want to forget it. That's why this is the reason why I'm teaching. Regionalization of neural tube. Now that we understood that this tube is made, this tube, you saw that tube, we take out this tube outside, because we understood that it is made of a neural ectoderm and notochord helped with it, and it has the lateral wall becomes anterior port and posterior port, sonic H-Hawk gene for the anterior and bump for the posterior. So everything we understood. Now we take out this tube and bring it here. Now see this tube. Now this is the tube that we talked that this tube was made, and it makes CNS. So how does it make CNS? So slowly, at first, it is divided in 3 parts. The first part is called forebrain, and the middle part is called midbrain. Of course, it makes sense. And the last part is called hindbrain. So forebrain, when you say forebrain, kind of you remember that it could be like forehead. So you know that, or also if you look at the Latin word like prosencephalon, you know that pro means something in advance, something like primary. So prosencephalon means primary brain. Forebrain the front of the brain. So forebrain or prosencephalon develops into a telencephalon and diencephalon. Telencephalon, the way I remember telencephalon and the mnemonics I'm going to share with you all, just let's read the first bit first, and then we will go ahead with the mnemonics. So telencephalon and diencephalon is made of the forebrain. It means that the forebrain or prosencephalon makes the encephal. It is the primary brain tissue. Pro means primary, right? So it makes the telencephal and diencephal. It makes the brain tissue. Which part of the brain tissue? Telencephal is the front part of the brain. Tele. Whenever we see television, we see with eyes, right? So mostly the frontal part of the head, telencephalon makes the frontal part of the head, and diencephalon is afterwards. So the telencephalon makes the cerebral hemisphere and basal ganglia. Even if you forget basal ganglia, it is good to remember that cerebral hemisphere are made of telencephalon, because this is very important. Basal ganglia, whenever you are doing first aid and revision, it's okay to read it, but to remember it, cerebral hemisphere is very important, that it's made of telencephalon. And for diencephalon, two things are made. Di means two things. One is thalamus and the other is hypothalamus. Thalamus and hypothalamus is made of diencephalon. So even if you forget retina, it's okay. I have not seen questions on step 1 and step 2 in UWOT MBBs or anywhere that is asking about retina is made of diencephalon. It is made of diencephalon. It is okay to read it, but to remember, you should remember thalamus and hypothalamus. It's made of diencephalon. That's very important. So now that we understood that forebrain or proencephalon makes telencephalon and diencephalon, and telencephalon so makes the cerebral hemisphere and thalamus and hypothalamus. And of course, we know that whenever cerebral hemisphere is made, in between cerebral hemisphere, there are cystic spaces that are making the lateral ventricles. So these are the lateral ventricles, and with thalamus and hypothalamus, there is third ventricle. So the only thing that you remember is this one, telencephalon for the cerebral hemisphere, because whenever we are watching television, we are watching with our eyes, and we are listening or hearing with our ears, right? So telencephalon, just remember two cerebral hemisphere that covers all our eyes and ear and everything. Just this is like a mnemonic to remember. And diencephalon, whenever you see di, it means that there should be two things with the same name, thalamus and hypothalamus. And whenever and cerebral hemisphere contains lateral ventricle, and thalamus and hypothalamus contains the third ventricle. We are going to do all of them and the connections later on. So, and the midbrain, of course, the name says it is making the midbrain, and it's easy. Whenever we see that the embryonic name and the fetal, the developed name is the same, so it makes work easy for us to remember. So midbrain makes the midbrain. And the other name, the Latin name, is also always an issue. And believe me that you will see questions with the Latin names, mostly mesencephalon, prosencephalon. But don't worry, I'm going to help you how to remember this. Mesencephalon, just look at the mes. Mes is at the beginning, right? Mes, you remember that mes was from mesoderm, right? Mesoderm, and mesoderm was making the intermediate space and the middle space, right? So you don't forget, mesencephalon makes the midbrain, middle side of the brain. That's why it makes easy to remember. So, and the ventricles, or the space that has CSF and midbrain, what that is called cerebral aqueduct. So we have lateral ventricles. That lateral ventricles makes the CSF and send it to third ventricle, and third ventricle sends this to aqueduct, and through aqueduct, the CSF goes into fourth ventricle. Now we know that prosencephalon makes the forebrain, right? Prosencephalon makes the hemisphere and thalamus and hypothalamus with their ventricles. Mesencephalon, meso is always in the middle. So meso makes the midbrain, and midbrain has cerebral aqueduct inside. And whenever we say hindbrain, it is easy. Hindbrain is the last part of the brain. Last part of the brain is cerebellum, pons, and medulla, right? How to remember these? These are made rhombencephalon. Just I used to remember like this: M for medulla, M for myelencephalon, M for mesencephalon, M for ram. This also has M. Just ignore this M because this was mesoderm is in the middle, so we cannot confuse that. We cannot say that mesencephalon is making medulla, cerebellum, and pons, because that was mesoderm, meso. It is not mesoderm, just the same as mesoderm. So meso means mid. It makes midbrain. Just I'm trying to make ways to remember it, right? And whenever we say rhombencephalon, mesencephalon, myelencephalon, medulla. And we know that the friends for medulla is pons, cerebellum, and medulla. They are all together always. Cerebellum is in the back, pons and medulla is in the front, right? So mesencephalon, myelencephalon, rhombencephalon. There are some other mnemonics we can also use that. Cerebellum, pons, and medulla, cerebellum, pons, they're friends. They meet together. So mesencephalon makes pons, medulla, and cerebellum. These mnemonics are really helpful, dear doctors. Believe me that it is going to help you save time for difficult questions. We don't need to think a lot about these questions because these are memorization and we have no choice but to have mnemonics for them. So now that we understand, let's collect all together. We know that prosencephalon is the precursor of the real brain. Real brain is the cerebral hemisphere. The telencephalon part of the prosencephalon makes the cerebral hemisphere with the lateral ventricles. Diencephalon makes two things in the brain, which are thalamus and hypothalamus, and they have the third ventricle inside. And the mesencephalon, mesodermic encephalon, makes the midbrain. Midbrain has cerebral aqueduct inside, and whenever we say rhombencephalon, that's this divided. This develops into mesencephalon and myelencephalon, and this makes three friends together. They meet and they have M. All of them has M. Mesencephalon, myelencephalon, mixed medulla, cerebellum, and pons. And we all, of course, know that the cerebellum, pons, and medulla is in the neighborhood of fourth ventricle, which is the last ventricle of the brain, right? So this is how I used to read this part, because this is fully memorization. Even if you know the mechanisms and everything, still you have to remember. So telencephalon is the first part. Of course, we know that telencephalon makes the cerebral hemisphere. Diencephalon is the second part that makes thalamus and hypothalamus with their ventricle. The rest are arranged alphabetically. Mesencephalon, metencephalon, myelencephalon. Either way, whichever is easy for you. I didn't use this mnemonic, but I had my own mnemonic because that was making it easier to me, right? So let's go to the central and peripheral nervous system origins. Now that we know that this was endoderm, this was mesoderm, the notochord was inside, and the notochord had a gene called sonic hedgehog, and this one pulled the neural plate inward, the ectoderm inward, and made a neural tube, and this neural tube had crests and periphery. We know that this tube in D22 made the CNS and this particles made the PNS. Now it's easy for us. We understand these lines easily because we already know the concept. So a central and peripheral nervous system origin, neuroepithelia and neural tube. Now that we say neural tube, it's kind of familiar for us because we know that neural tube is this tube that notochord helped to be developed, right? So neural tube makes what? It makes CNS. Of course, we already know that this is a tube. It makes CNS, and the upper part that makes the brain, and the lower part that makes the spinal cord. And whatever related to CNS is made of this neural tube. So glial cell, all the glial cell. Whenever we say glial, it means that we are talking about the neuronal cells and the CNS, right? So the CNS, it's neurons, and the CNS glial cell. What is the difference between neuron and glial cell? Neurons are the cells that these are the cells that transmit, make neurotransmitters and also send impulses and transfer impulses, right? And glial cells are non-neuronal cells. They don't have the function of neurons. So overall, we say that neural tube makes the CNS, all the CNS. Neuron of the CNS, cells that are not neuron, but they are in CNS. They make everything. So neuronal cells and non-neuronal cells, belonging to CNS, everything is made of this neural tube that we already studied. So about neurons, we know that the neurons have a dendritic port, axonal port, and body and everything. But about glial cell, we need to know some cells that are in CNS and they have some functions like astrocytes, oligodendrocytes, epidermal cell. Epidermal cell, we already know that epidermal cell are these cells, the inside of the neural tube that is making that is surrounding around the area of the ventricle. We already know that. We already studied that, right? And astrocyte, what is astrocyte? Astrocyte is like, I used to remember this like a store of the house, astrocyte, store of the house, the store of the brain. It means that it does everything important for the brain. So for example, in your house, in your home, where you're living, there is somebody who always helps with the removing the trash out of the home, fixing the power and electricity, bringing food for the house. Whenever somebody's sick, brings the medicine. Is there somebody like that in your house, or you do it all yourself? Can you talk to me? And your family, who is the star of your family? A star of the family is someone who brings food for the family. Whenever something is damaged, repairs that for the family. And whenever something is needed, they bring it for the family. And whenever somebody is sick, they come and help with that person. And whenever there is a trash to be removed, to he or she takes it out. And this is for me, this is like a store of the house because it does everything important for the house. And for the brain, astrocyte does all these jobs. And it's so hard to remember astrocyte function all one by one. Just make it like a story and make it easy, make it fun, and so that you remember it. You don't need to repeat it again. Whenever you say astrocyte, you just remember astrocyte was a star cell. A star cell means that the cell that is a star of the brain and helps with the repair of the brain. Whenever a brain is injured, astrocyte comes and repairs it. Whenever there is an dead tissue, astrocyte comes and removes it, right? And whenever brain is so, we will study all the function of astrocyte. It is so good to remember this way. You will never forget it, and believe me, this will made it easy for me. And whenever we say oligodendrocyte is the myelin or the cover of the nerve. The neuron cells, the neurons and CNS is made of the neural tube. Of course, it's made of neural tube. Even the cover of neurons and the CNS is made of neural tube, which is called oligodendrocyte. Oligodendrocyte is the cover of the neurons inside the CNS. So now we know everything about CNS. We know that CNS is made of cerebral hemisphere and every belongings of the brain and the up and down. So spinal cord is made of the neural tube and all the cells inside the CNS, like neuronal cells or non-neuronal cells, are made of the neural tube. So neuronal cells, we already know the neurons, and the non-neuronal cells are called glial cells. Glial cells has astrocyte, oligodendrocyte, and epidermal cell. Astrocyte is the store of the brain. Oligodendrocyte is the cover of the nerves inside the brain, and epidermal cells are the cells around the ventricles. Are you with me? Okay. So now that we understood about neural tube and the particles around the neural tube, we already know that those particles should make the peripheral nervous system because they're in the periphery. So neural crests are the particles around the neural tube and early development, which they make the peripheral nervous system neurons. We already know that. So what are the neurons and peripheral system? Dorsal root ganglia and the spinal cord. We will study that if we continue neuro. So dorsal root ganglia is in the spinal cord, the dorsal part of the spinal cord. There is a ganglia that all the neurons get together and go to the dorsal column, right? And autonomic ganglia like sympathetic and parasympathetic enteric nervous system. We already said that these neural crest cells go to the GI system and make the enteric nervous system. Enteric nervous system is the nervous system for the gut, and it helps with the gut function. Whenever neural crest has a problem, of course, the neural crest will not go to the gut, and the patient will have neural crest cell dysfunction, and the patient will have difficulty defecation, which is called Hirschsprung disease, right? So, and the PNS glial cell, the same way that CNS had neurons and non-neuron cells. So the neuron cells like dorsal ganglia, autonomic ganglia, and the glial cell. What are the glial cell of the PNS? Glial cell means the cells that are not neuron, they are non-neuron. So the non-neuronal cells are the Schwann cell, and Schwann cell is just like the oligodendrocyte, but in the PNS. It means that it is the myelin or the cover of the nerve and the periphery. And they also have satellite cells. Satellite cell is just like astrocyte. Astrocyte was the star of the brain, and satellite cell is the star of the peripheral nervous system. Satellite cell has the same function as astrocyte. Just find the common things and compare them together and remember them. It makes easy for you to for your review will be easy if you study this way, in my opinion. So, and we also said that this neural crest cell goes to adrenal medulla and makes the adrenal medulla, which is making producing norepinephrine, especially. And the microglia is also made of mesoderm, and microglia is the macrophage of the brain, and that's macrophage or the immunity of the brain. So now that we did the first page of first aid from neuro, I hope everyone understood that. Let me see if anybody has any comment. Yeah, husband is the star of the house. Yes, for Asian people, especially, yeah. But most of people nowadays, even women, are also star of the house. So in some families, women are doing a great job, right? But for me, I'm only able to study well and to teach well, so I'm not the star of my own family, and my husband is, and thanks to him, because if there is no support and help, we cannot go ahead. But still, we are all doing great job. And so, how is it? Do you like the way I explain? Because I'm explaining so basic and so simple. I hope you guys don't become tired of my explanation because I'm going slow and going so simple. Just because first aid should be studied like this, we need to know every single word and go ahead, right? So, do you understand me, everyone? Is it helpful or not? Should I go ahead? Should I go for another page?
Yes, please go ahead.
Okay, thank you. Just let's have a 1 minute break and then we will go to the other page, okay? Okay, I'm back. I had to take some tea just not to. Okay, let's continue because we have to save time and we have to be productive. And uh, if we continue together, I really like people who has commitment, who has consistency, and life class is a way that makes you to be consistent. And there is someone to push you, there is someone to follow you, and it's very helpful. Like if you all continued with me, I'm going to whenever I finish embryology section of the neuro, I will make a block from UWord and give the ID for everyone, and then and the next day I will see in the group that everyone should do it. If anybody doesn't do your work on the same day, I will remove it from the group, and that's my rule. And I have done with my other students, and this was really helpful. Their scores really improved, and uh, they had a really good schedule and a study plan to follow. There isn't any specific study plan. This is the study plan. You read first aid and you just use the concept that you learned from first aid, you use it in the U word, and you just every day you have to do 5 pages of first aid and 40 questions of you word for a beginner level. If somebody is on the halfway or at the end of their prep, they can make it more, like 10 pages of first aid every day and 2 blocks of e-word. And this is not a big deal. It doesn't need to have a big plan or a lot. Let's make it easy, not very difficult, just to enjoy the process, right? So let's continue with the other page. Let me share my screen again. So now we say neural tube defect. Now that we know the basic, we know the base that what is neural tube. Neural tube is the tube that is making CNS and spinal cord, and the notochord was helping it with sonic hedgehog gene, and it makes the neurons and non-neuronal cells of the CNS. So everything we know about that, right? Whenever we say neural tube defect, that means that whenever this neural tube is made, there there can be some defects. And why these defects are there in the tube, if the tube is defective? Because at the beginning of the development and early stages, if we see the tube from upward, I mean that if we see from the upper part of the brain and look downward to the tube, this tube is made like this. It means that the middle part of the tube is closed, but the upper part of the tube is open. And the lower part is also open. It means that day by day, during development, the upper part and the lower part closes. So whenever we understand this concept, we know that if the upper part of the tube is not closed, this is called neural tube defect. If the lower part is also not closed, this is called like neural tube defect, but with a different name. For example, if the upper port is not closed, it makes cranial dysraphism or anencephaly, right? Because this cannot make the upper part of the brain. And if it is not closed in the lower port, and if the lower port is not developed well and it's open, then we say that spinal dysraphism. Of course, we know that the lower port makes the spinal cord and the upper port makes the brain. So, and mostly in questions they don't say upper port and lower port. For understanding, it's got to say upper brain and lower upper neural tube or lower neural tube. But for the example purpose, we should say rostral neuropore. Neuropore means that the neural tissue which is open, which has a pore inside. Rostral means the upper port, and caudal means the lower port. So these are the terms that they usually use it in the exam. So what happens? Why does the neural tube doesn't close? So failure of neural tube to close completely by week 4 of development. It means that week 4 of development, this is the time that even a lady does not know that she's pregnant. Even she doesn't realize that she's pregnant, because mostly the ladies, whenever they have late menses, they go and check their they do a pregnancy test, right? So 4 week of development means that still 1 month is not completed in the menstrual cycle. So here the woman doesn't even know that she's pregnant, but the embryo is growing inside, right? So the neural tube should close before the week 4 of development. And why doesn't it close? And mothers that has folate deficiency. Folate is vitamin B9, right? Vitamin B9 is folate, and folate is very important. Why is folate important? That's why whenever a mom wants to try for conception and goes to the gynecologist, the doctor gives folic acid or folate 3 months before conception. It means that 3 months before conception, giving folate is important. Why? Because if the lady who is trying for conception gets pregnant, she is already having enough folate to make the neural tube and to close the neural tube, right? So folate deficiency is a very the most common cause of having neural tube defect. And how we diagnose the neural tube defect? Of course, with ultrasound, we can see if the rostral neuropore is not closed, we don't see the neural tissue in the head of the fetus, and we see anencephaly. We just see the eyes. We don't see the brain and the upper part. And we see maternal serum alpha fetoprotein, which is also, I'm going to explain why. And before that, let's go for the cause first, see how folate deficiency causes the neural tube defect. let's bring biochemistry here. Let's integrate biochemistry here because we are talking about folate. Why is folate so important for the neural tissue to develop, right? To close. So let's see. I brought a picture from biochemistry, and I really love biochemistry because everything in biochemistry makes sense if we read it properly. So neural development. So for neural development, we said that folic acid is very important. Let's see how does it make. We know that whenever embryo is growing, we need a lot of DNAs because DNA is the part of the cell that helps with the development and growth. So we want to make deoxy-TMP or deoxythymidine monophosphate. Thymidine, whenever you see thymidine in biochemistry, you know that this thymidine is a nitrogen base for DNA, right? And whenever you see uracil, I know everyone knows a little bit about biochemistry, even if you haven't started biochemistry already. But whenever you say uracil, you know that uracil is a nitrogen base for RNA, right? So uracil, diuridine monophosphate, dithymidine monophosphate. It's okay. We can ignore the monophosphate and diphosphate and these things. Just look at the uracil and thymine. Uracil is RNA and thiamine is DNA. Preca means that nitrogen base for important for DNA. So whenever a fetus is growing or an embryo is growing, we need DNA more than RNA. So we need to change all the RNAs in the cell to DNA, right? Right? So we need to make more DNAs. We need to change uracil to thiamine so that we make DNAs, more DNAs, right? And the enzyme which is helping uracil to change to thiamine. Let me clean the area. So the enzyme is called thymidylate synthase. If you look at the name of the enzyme, it clearly says the function. Thymine, don't ignore the thymidylate. It's okay that we don't know the names properly, but just look at the thymidine. Thymidine, we already said that this is a nitrogen base for DNA. So thymidine synthetase, it means that it's an enzyme that syntheses thymidine, and thymidine is important for DNA. So how does this enzyme makes thymidine? It makes thymidine out of uracil. Uracil is a nitrogen base for RNA. So how does it do that? How does enzyme helps uracil to change to thymidine, and how this enzyme changes RNA to DNA, right? Let's see. This enzyme, anyone knows the difference between uracil and thymidine? Anyone who has done biochemistry? Do you guys know? You can unmute yourself. What's the difference between uracil and thymidine? Anybody? What biochemistry concept? Let me see if anyone has answered here. Okay, nobody has answered. So, okay, it's okay. No worries. I'm going to explain it myself. Just I want to make the class interactive. I'm sorry for asking questions because I don't want this class to be dead. I want this class to be live, right? The purpose for live class is that we should talk. We should all be awake and interactive. So uracil and thymidine. Uracil makes RNA and thymidine makes DNA. This is one difference. And the other difference is that uracil and the nitrogen base is lacking a group of methyl group. It means that if we add a methyl group to uracil, it changes to thymidine. This is so easy. I'm not teaching biochemistry here, but just telling a small difference and a very important difference. Uracil and thymidine has this difference. Uracil is lacking methyl group and thymidine has the methyl group. So this enzyme, which is called thymidine synthase, it means that this enzyme is making thymidine. So this enzyme adds a methyl group onto the uracil and changes uracil to thymidine. So does that make sense now? We know that this enzyme, the name of the enzyme is so easy to remember. We don't need to memorize it. Thymidine synthase means that the enzyme makes thymidine. How does it make thymidine? It makes thymidine from the uracil. How does it change uracil to thymidine? Because uracil doesn't have methyl group and thymidine has a methyl group. So this thymidine synthase adds a methyl group to uracil and changes it to thymidine. Okay. So how we find this methyl group? And this tetrahydrofolate is the methyl donor, right? They usually call it methylene tetrahydrofolate. Means that the tetrahydrofolate is a methyl donor. It gives methyl. So this thymidine synthase takes the methyl group and puts it on uridine and changes it to thymidine. Are you with me? Do you understand what I mean? So here, see, this enzyme takes out methyl group and adds it to uracil and changes uracil to thymidine. Now we understood everything. So this is tetrahydrofolate. Tetrahydrofolate is the storage form of the folic acid. The folic acid that we are taking, this is, and the body, it changes to dihydrofolate. Then dihydrofolate reductase changes this dihydrofolate to tetrahydrofolate, and this tetrahydrofolate is stored as methylene tetrahydrofolate and is waiting for thymidine synthase to come and take the methyl group and put it on uridine and change it to thymidine and make a DNA. Does that make sense to everybody? Are you with
Yes.
me?
Yes,
Okay.
it does.
Thank you, doctor. Okay, so now you know the concept. Now you know that why folate is important. Whenever somebody has folate deficiency, can she make dihydrofolate? No, she cannot. Can this hydrofolate change to tetrahydrofolate? No, because this dihydrofolate is made out of folic acid. So this is the way that when there is no tetrahydrofolate, there is no methyl group, the thymidine synthase fails and cannot change uracil to thymidine and cannot, the neural tube cannot close and cannot develop, right? So what is the other cause of folate deficiency in patients that they have sufficient folate, but they cannot make DNA. They still have neural tube defect, and that is a drug called. Anyone remembers the drug that is decreasing the amount of folic acid in our body? Do you remember this drug? Methotrexate, right? Oh, sorry. I'm sorry because I don't have my pen today. I'm writing with my hand. Sometimes I cannot write it properly. So methotrexate is a drug or medicine that we usually give it for different purposes. Like we give it as DMARD for rheumatoid arthritis, for autoimmune diseases, for different purposes, right? So methotrexate is inhibiting or blocking this enzyme, dihydrofolate reductase. That's why those who are receiving methotrexate for rheumatoid arthritis, especially, they are blocking this enzyme. However, they have dihydrofolate reductase, still they cannot make tetrahydrofolate because tetrahydrofolate is the storage form of the folic acid, which is carrying methyl and helping uracil to be changed to thymidine. So now we understood two causes of neural tube defect. One is folate deficiency. When there is no folate, there is no dihydrofolate. And when there is folic acid and there is dihydrofolate, but this enzyme is blocked by a medicine called methotrexate, then tetrahydrofolate is not stored and there is no methylene donor for the thymidine synthase to change uracil to thymidine. Is it okay? Does that make sense now? Okay. So let's go ahead. So we already understood the cause of neural tube defect due to folate deficiency and due to the medicine which is blocking the enzyme which is changing folate to tetrahydrofolate, right? The diagnosis with ultrasound, whenever we are suspected, whenever a lady comes to the office and she has no antenatal care or this is her first time she comes to the doctor and the doctor finds out that because she doesn't know that if she took folic acid or anything, then the first thing is to do ultrasound to see if the tube is open or closed. Because in ultrasound, we have a lot of clues for the neural tube defect that I'm going to say right now. And in the maternal serum, we see alpha fetoprotein. Alpha fetoprotein, the name says that this is a protein which is made in the liver of the fetus. Alpha fetoprotein, right? It is made in the liver of the fetus. So how does it come to the maternal serum? Can you guess how something from inside the body of the fetus come to the amniotic fluid or the serum of the mother? There should be something open in the baby, right? Something should be open in the baby. I mean, something in the back of the baby should be open. Something in front of the baby should be open. In the back, we have a spinal cord for the babies, and in the front, we have belly. We have the stomach. So if we have abdominal wall defect, the alpha fetoprotein will increase, abdominal wall defect, and whenever we have a neural tube defect, NTD, abdominal wall defect, neural tube defect. In both cases, we see alpha fetoprotein elevated in the serum. Whenever we see in a question that alpha fetoprotein is increased, just remember like this, that there should be something open in the baby, either in the front or in the back. So in the back, it is neural tube defect, and in the front, it is abdominal wall defect. So whenever a baby has gastroparesia, whenever the baby has omphalocele, this is an abdominal wall defect. And GI system, you will see this alpha fetoprotein again. So you should understand the concept that why it's coming out. So how do we know that this alpha fetoprotein is coming from the back of the baby, not from the defect in the front? Can anyone help me with that? So whenever we say neural tube defect and alpha fetoprotein is increased, we say that this alpha fetoprotein is coming from the back whenever we see another enzyme, which is called acetylcholine esterase. Acetylcholine, you all know that acetylcholine is a neurotransmitter. So whenever you see a neurotransmitter with alpha fetoprotein, you know that this alpha fetoprotein means that somewhere is defective, somewhere is open. And this acetylcholinesterase helps you to localize where is open, because acetylcholine is coming from neural tissue. So you know that this alpha fetoprotein is coming from the back of the baby, which is the spinal cord. So the patient has neural tube defect, not abdominal wall defect. If you see that there is no acetylcholine and there is increased alpha fetoprotein, then you know that this could be abdominal wall defect without ultrasound. But if you do ultrasound, of course, you can see the abdominal wall defect and the anencephalal or spinal neural tube defect anywhere by ultrasound. But by the serum, because the questions you usually see arrows up and down. And this concept really helps you with this one. So, and alpha fetoprotein is up in these two conditions, abdominal wall defect and neural tube defect. Alpha fetoprotein is down and somewhere. Anyone remember when alpha fetoprotein is less? These concepts are really integrative. Whenever you see alpha fetoprotein, just remember when it is up, when it is down. For the up, you understood that there should be a defect in the abdomen or there should be a defect in the spine, so that alpha fetoprotein increases. And when it is decreased down, when I say when is alpha fetoprotein down, you should remember Down syndrome. Down syndrome is, what is Down syndrome? Down syndrome is trisomy 21. Everyone knows about Down syndrome. So alpha fetoprotein is down and Down syndrome. It's easy to remember. And it is up. Where is it up? It is up in the defect in the body of the fetus, either in the front or in the back. Do you guys understand what I say? Does that make sense to everybody? So let's go and see the neural tube defect with a spinal dystrophism or cranial dystrophism. Cranial dystrophism, you already understood that if the rostral or the upper part of the neural tube is open, it is not closed. There is no forebrain. The clavarium is open. The bones that cover the neural tissue is open already. There is no brain tissue to be covered. It often presents with polyhydramnios. Why polyhydramnios with babies with anencephaly? Because we know that this amniotic fluid is made in the kidneys of the baby, and the baby pees out the amniotic fluid and then swallows it back into the system. So whenever the baby doesn't have a brain, doesn't have upper brain, is not fully developed, so the baby cannot swallow, because we know that the swallowing and everything belongs to the upper part of the brain, right? So the baby cannot swallow. If the baby cannot swallow, all the amniotic fluid stays in the outside, and we will see polyhydramnios with frog sign in ultrasound. This is very important that we only see 2 eyes in the baby. We don't see any brain tissue. It will be flat. And believe me, there has been a question in the exam on MBBs about this. And they show a picture of a baby, either an ultrasound or a physical baby that doesn't have a brain and just has high eyes. So, they ask that, what else do you see in ultrasound? You say that because the baby doesn't have a brain, the baby cannot swallow, so all the amniotic fluid stays outside and makes polyhydramnios. So this was about, because it was a small, I wanted to finish this one first because it was less, few lines. So we already did this. And now let's come to the spinal dystrophism. Spinal dystrophism means that the tube is not closed in the spine. And we know that as I said before, that the development and the beginning of the development, the middle part of the spine is closed and the upper part and the lower part is open. Whenever there is a folate deficiency or any other cause that delays the closure of the neural tube, it causes spinal dystrophism. Spinal dystrophism is very easy to remember. We don't need to go to the lines. Just spina bifida oculata. Oculata means it is occult. It is not clear, visible, right? Whenever we say meningocoele, myelomeningocoele, and myeloschisis, I help you how to remember all these three. When seal means a bag. Whenever we see seal in any medical term, whenever we see hydrocele, it means water is inside a bag. Whenever we say varicocele, it means that there are veins inside the cell, right? Whenever we say hematocele, it means that blood is inside the cell. Whenever we say omphalocele, it means that umbilicals are inside this bag, right? Whenever we say meningocele, it means that the meninx, which is the cover of the brain and spinal cord, the meninx is inside the cell. It means that there is a skin above that and the meninx comes out, right? This is meningocele. And whenever we say myelomeningocele, it means that meninx with some neural tissues and into a bag. And everybody knows that. Whenever we say myeloschisis, whenever we say schisis, it means that there isn't any seal or any bag. Everything is visible. So whenever we say gastroschisis, means that the intestines are out of the abdomen without any cover, without any bag. Whenever we say myeloschisis, it means that neural tissue is out of its place without a bag, right? So we already understood the name of everything. So closed neural spina bifida oculata, because it is not visible, it must be a neural tube defect, closed neural tube defect, but failure of caudal neural tube to close. There is no herniation. It means that neither the meninx nor the myelomeninx are out of the spinal cord. Dura is intact. We know that the meninx is made of 3 layers. One is dura, the middle is arachnoid, and the one which is attached to the brain and the spinal cord, that is called pia mater. So dura is intact. It means that the dura is not out of the place. Usually seen at lower vertebral levels, associated with tuft of hair or skin dimple at the level of the bony defect. So usually in questions for step 1 and step 2, they usually ask that if a mother is not taking folic acid before conception, if the mother is taking methotrexate, if the mother is taking anti-seizure medication like valproate, those are also decreasing the folate level. So what do you do with the fetus when the fetus is born? We usually check the tuft of ear and skin dimple in the level of the in the lower part of the spine. So why? Because we see that spinal cord inside the vertebral canal, it should be like a closed space, and the spinal cord should be in a closed space. Whenever in the back of the baby, this bony defect is present, so sometimes whenever the meninx is out, it is called meningocele. Sometimes the neural tissue with the meninx is out, it is called myelomeningocele. But whenever there is nothing out, just the bony defect is there, and the skin is also okay, we cannot see anything outside the spinal canal. So we only check the tuft of ear and the dimple of the skin here, because this is very important to be helped earlier. Because if we don't help with this condition, if we don't catch it early, later on all the neural tissue gets together here and makes caudo-equino syndrome, and which is a really it has a lot of morbidity, and it is not a good complication, right? Because it has poor prognosis. So this is the step 2 concept, because they usually say that whenever you don't catch this, what happens? Even if there is a lipoma here, if there is a dimple over there, if there is a nevus over there, whatever, when you see in the back of the baby, it should be followed, because later on, when the baby grows, all the neural cell tissue gets together here and makes cauda-equina syndrome. And that's a really, okay, I'm sorry for this. I wanted to clean the area. So a spina bifida oculata, everyone already has idea about that, so I don't want to waste a lot of time on that. Let's go to meningeal. It is open neural tube defect, because whenever we see sealed meninges are out, meninges, but not neural tissue, and next through the bony defect. Myelomeningeal, whether it is named, we know that both meninges and the neural tissue comes out of the open tube, and myeloschizia, open tube, exposed unfused neural tissue without the skin. So we already know that whenever we see seal, there is a back. Whenever we say schisis, there is no back. Gastroschisis means that intestine are out without any back. Whenever we say omphalocele, means that the intestines are inside the back. So it makes it really easy, because we usually see questions, and during the NBME stress and lots of adrenaline cannot help us to remember these concepts so easily. But this one really helped me during my prep. Whenever I used to see seal, I used to imagine that it is inside the back. Whenever I saw a schisis, I used to imagine that this is out of a back, right? And this was really helpful for me to diagnose some of the concepts. So let's do this brain malformation, and then we will finish the class, because it's already more than 1 hour. I don't want to make everyone tired, but for me, it's okay. I can teach hours, and I can be engaged with first aid for hours, because I really love the way that first aid is explaining everything. So brain malformation, we already understood about the tube defects. We understood that if the tube is open in the app or rostral port, it is anencephaly with polyhydramnios. If the tube is not closed in the lower port of the spine, this is called a spinal dysraphism. And remember that usually they are playing with words. They don't say neural tube defect. They say a spinal dysraphism. In step 2, I saw questions that they don't say neural tube defect. They say spinal dysraphism, cranial dysraphism. Just be cautious about that. You might see questions like that. So they are playing with the words. We need to be on the safe side to know all both synonyms. So brain malformation often incompatible with postnatal life. Survivors may be profoundly disabled. Whenever brain is malformed, of course, we know that all the functions, motor functions, sensory functions, everything is managed by the brain. So if the brain is not properly made, of course, the baby either will not survive, or will be disabled profoundly, right? So a haloprosencephaly, it is, we already said that telencephalon or prosencephalon, which was the precursor of the encephal tissue or the brain tissue, whenever it cannot make telencephalon and cannot make the cerebral hemispheres, so the prosencephalon stays together. It means that the brain is not divided into two cerebral hemispheres. The brain is one hemisphere. This is called holoprosencephaly. And how I used to remember holoprosencephaly, holo means all together. Holoprosencephaly means that prosencephaly could not split the brain into two cerebral hemispheres. Prosencephaly is all together. It means that both cerebral hemispheres are all together. This way, I remember whenever I see holoprosencephaly, I know that all brain is together. They are not separated into two cerebral hemispheres. Failure of forebrain, which is called prosencephaly, to divide into two cerebral hemispheres. This is called holoprosencephaly. Developmental field defect usually occurring at the week of 3 and 4 of development. We know that because this is the week that neural tissue is made, associated with sonic hedgehog mutation. We already know that sonic hedgehog is a gene which is located in notochord, and that was so helpful in brain and neural tube development, right? Especially the anterior part of the neural tube. You can also see it in trisomy 13. This is some what how you can see in your questions about the haloprosencephaly and association with trisomy 13, which is called Patau syndrome. And in Patau syndrome, everything, all the defects are in the midline. So it is not difficult to remember, because in Patau syndrome, whenever you see a picture of a baby with Patau syndrome, you see that all the defects are in the midlines, and haloprosencephaly is also a defect in the midline. Presence with midline defects, monoventricle. Of course, when the brain is not split or divided into two cerebral hemispheres, the ventricle is also not lateral, it is monoventricle. Fused basal ganglia, the basal ganglia is also not two, because we already know that basal ganglia is also a part of prosencephaly. Cleft lip, cleft palate, it is also cleft lip, and cleft palate is also a midline defect, right? Hypothalamusm, cyclopia, proboscis. These are the terms that they usually present with picture, like a baby with one eye on the forehead. Whenever you see a baby that has one eye in the forehead, you know that this is a midline defect. It should be associated with the haloprosencephaly. And of course, when the brain is not properly made, there will be pituitary dysfunction, and the patient will have diabetes insipidus. What is diabetes insipidus? We know that in the posterior pituitary, we have two hormones. One is ADH, which is called antidiuretic hormone, and the other is oxytocin. Whenever we say ADH, it means antidiuretic hormone, an hormone which stops the diuresis, which does not let the diuresis to happen. It keeps the water inside. Antidiuretic hormone. So it has the other name for antidiuretic hormone is vasopressin. Vasopressin. It means that it presses the vessel. So antidiuretic hormone has two names and has two jobs. The one job is it stops the diuresis. It keeps the water antidiuretic. It means it doesn't let the water to go out. And whenever we say vasopressin, it means that it presses the vessels. Pressing the vessel means that constricting the vessel, making the blood pressure to go up, right? So ADH and vasopressin both are the same hormone with two names and two functions. They come from pituitary gland. Whenever pituitary gland is not working, ADH is not released. When there is no ADH, there is nothing to stop the water to go out. So all the water goes out of the body as urine, and the patient becomes dehydrated. So ADH and vasopressin, we have two receptors for both of them. One is called V1 and the other is called V2. ADH is ADH goes to V2 receptor, which is in collecting duct, and vasopressin goes to V1 receptor, which is in the vessel. So both of them has its own receptors and their own functions. I hope this integration also helped you to know about the diabetes insipidus. Diabetes means that the patient is peeing a lot, going to the restroom a lot, losing water a lot, but it is not due to sugar. It is due to pituitary dysfunction or maybe the receptor dysfunction in collecting duct. And the last lesson for today is lesencephaly, and I have a mnemonic for this, and I will also share that mnemonic with you also, that it is easy for you. Failure of neural migration. Neural cells do not migrate. A smooth brain. Brain is a smooth. Brain doesn't have gyrus. Previously in our medical schools, our teachers used to say that if the brain has a lot of wrinkles, a lot of gyrus, the patient has good memory. The individual has good memory, and the individual can maintain a lot of information. If the brain is smooth, it means that there is no gyrus. So if there is no gyrus, the individual does not have a good memory or the good function, right? So a smooth brain surface that lacks sulci and gyri, presents with dysphagia, seizure, microcephaly, and facial anomalies. Of course, these anomalies are seen in most of the brain malformations, but how to remember lesencephalon? Because they usually test you with lesencephal and smooth brain. I used to say lazy. Lazy means someone who does not understand well. Lesencephal. Don't say it lesencephal. It means that some people who is lazy. I'm not disrespecting anybody, just to make it easy for us to remember. Lesencephal means that the brain which is lazy. The brain, lazy brain, neuron. Someone who is lazy do not want to move, right? Lazy people doesn't like movement, right? So neural migration is a stop because the brain is lazy. It does not move, right? This is one concept that they are usually asking questions. What is the mechanism behind the lesencephaly? you cannot remember it something. Just remember like this. Some people who are lazy, they don't move. So neuronal migration is defective here. And those who are lazy has less gyrus. Their brain is smooth. They don't have wrinkles in the brain. The brain is smooth, so they don't understand well. So it doesn't mean that lesencephal people are lazy, but just to make it easy to remember and answer the questions. And this was the lecture for today, everyone. I hope you enjoyed this, and thank you so much for your time and for your patience. I'm sorry if I couldn't explain well enough, and or if I was fast or slow. This is it, and this was a demo for my lectures. If you guys want to continue, we will have another demo as well, and I'm going to post the date and the Zoom link. Now I'm going to stop the recording, and everyone who has any suggestion or request, I'm here to